Is exchange transfusion effective for stroke prevention in SCD? Imagine a treatment that can significantly reduce the risk of stroke in people with sickle cell disease. Exchange transfusion is that treatment. It works by lowering the amount of sickle hemoglobin in the blood, usually to less than 30%. This decrease makes it less likely for sickle-shaped cells to block blood flow in the brain, which can cause a stroke. The process involves removing some of the patient's blood and replacing it with healthy donor blood. This exchange improves oxygen delivery and reduces the sickling of red blood cells. When blood cells are less sickled, blood flow in the brain becomes smoother, lowering the chance of blockages that lead to strokes. For children at high risk for stroke, especially those with abnormal transcranial Doppler ultrasound results, regular exchange transfusions have been proven to be very effective. These treatments are part of primary stroke prevention, meaning they help prevent a first stroke from happening. Clinical studies show that maintaining low sickle hemoglobin levels through these transfusions can cut down the risk significantly. For patients who have already had a stroke, exchange transfusions are also recommended to prevent future strokes. Keeping sickle hemoglobin levels below 30% and maintaining a healthy hemoglobin level around 10 grams per deciliter helps improve blood flow and reduce the chances of another stroke. This approach is supported by medical guidelines and clinical experience, making it the preferred method for secondary prevention. Compared to simple transfusions, exchange transfusions are more efficient at lowering sickle hemoglobin levels and help avoid iron overload, which can be a concern with long-term blood transfusions. However, they do carry some risks, such as allergic reactions, iron buildup, and issues with blood vessel access. These risks mean that healthcare providers need to carefully monitor each patient during treatment. Guidelines from health authorities recommend exchange transfusions for managing acute ischemic strokes and ongoing prevention in sickle cell disease. When exchange transfusions are not available, simple transfusions may be used, but they are less effective for long-term prevention. In summary, exchange transfusion is a key part of preventing strokes in people with sickle cell disease. It is backed by strong scientific evidence and is included in standard treatment protocols worldwide. By lowering sickle hemoglobin levels and improving blood flow to the brain, it helps protect patients from the devastating effects of stroke. Still, it must be personalized and carefully managed by medical professionals to balance benefits and risks. Always consult with healthcare providers to determine the best approach for individual needs.